Hi, my name is Roman Lisowski and I am professor at Ivano-Frankivsk National Medical University. Today I want to talk with you about bioactive and biocompatible nanomaterials. Lecture objective: to introduce the audience to the fundamental concepts and classification of biocompatible and bioactive nanomaterials. To achieve this object, we need to address the following tasks: discuss the physico-chemical properties of biocompatible and bioactive nanomaterials, as well as the principles of their interaction with biological tissues. Explained current examples and application areas: medicine, rehabilitation, ecology, energy. Develop in the audience a critical understanding of the advantages, limitations, and challenges associated with the use of nanotechnologies in biomedicine and other fields. In the 21st century, the development of nanotechnologies has become one of the most influential factors, transforming modern medicine, biology, and materials engineering. Thanks to nanoscience, a new generation of materials has been created, with properties fundamentally different from traditional ones, and particle sizes compatible to proteins or even DNA. This has paved the way for the emergence of unique biocompatible and bioactive nanomaterials capable not only of coexisting with the human body, but also of actively interacting with its cells and tissues. Nanotechnologies are applied in many fields. Materials science, nanotechnologies enable the creation of new materials with unique properties. For example, carbon nanotubes exhibit exceptional strength and electrical conductivity, while nanoparticles can demonstrate novel optical, magnetic, and chemical characteristics. Medicines and healthcare. Nanotechnologies have revolutionized drug delivery systems, diagnosis, and medical imaging. Nanoparticles can be engineered to target specific cells or tissues, enhancing treatment effectiveness and minimizing side effects. Nanoscale materials are also used in biosensors to detect biomarkers and pathogens. Electronics and computing. Nanotechnologies have advanced electronics by reducing device size, improving performance, and lowering energy consumption. For instance, nanoscale transistors have enabled the development of faster and more efficient processors in computers and smartphones. Energy and environment. Nanotechnologies play a vital role in renewable energy resources such as solar panels, where nanomaterials improve light absorption and energy conversion efficiency. Nanoparticles are also used for environmental protection, including pollution control and water purification. Manufacturing. Nanotechnologies allow precise control over the fabrication of nanoscale structures and devices. In September 2015, during the 17th session of the UN General Assembly in New York, the UN Sustainable Development Summit was held, during which the post-2015 development agenda was adopted. The final document of the summit, Transforming Our World, the 2030 Agenda for Sustainable Development, established 17 Sustainable Development Goals and 169 targets. Ukraine, along with other UN member states, joined the global process of ensuring sustainable development. Achieving the SDGs in every context requires creative approaches, know-how, technologies, and financial resources from all sectors of society. Nanotechnologies can contribute to achieving these goals. Goal number 3: good health and well-being. Goal number 9: industry, innovation, and infrastructure. Goal number 6: clean water and sanitation. Goal number 12: responsible consumption and production. Goal number 13: climate action. Thanks to their nanoscale dimensions, nanoporous structures, and large surface area, nanomaterials improve the efficiency of diagnostics and treatment, contribute to the development of innovative materials and devices, are used in water purification and pollution reduction, enable more efficient use of resources, reduce emissions through energy-efficient technologies. What are nanomaterials? Nanomaterials are materials whose structural elements or particles are within the nanometer range, typically between 1 and 100 nanometers. 1 nanometer equals 1 billionth of a meter. At this extremely small scale, materials exhibit unique physical, chemical, mechanical, and biological properties, and that differ significantly from those of the same substances in their conventional macroscopic form. For comparison, the diameter of a protein molecule is about 5–10 nanometers. The thickness of a DNA strand is approximately 2 nanometers. It's precisely this nanoscale that gives materials new, unique properties not found in their macroscopic counterparts. Comparison of material sizes you can see on the screen. Types of nanomaterials. Nanomaterials come in various types and are classified by shape: nanoparticles, nanotubes, nanofilms. Composition: metallic, ceramic, polymeric, composite. And purpose: these materials can be made from metals: gold, silver, titanium, inorganic compounds, silicon, titanium, zinc oxides. Polymers, as well as biogenic substances, hydroxyapatite, collagen. Why are nanomaterials unique? Key properties of nanomaterials. A large specific surface area. The small particle size means that the surface area per unit volume significantly increases, enhancing reactivity and affecting interaction with the environment. Quantum effects. At the nanoscale, quantum effects emerge that alter optical, electrical, and magnetic properties. Mechanical properties. Nanomaterials can be significantly stronger and lighter. Surface modification capability. It's possible to alter the chemical composition, charge, and functional groups on the surface of nanoparticles. These features make nanomaterials very attractive for medicine and biotechnology because they can be tuned for specific tasks. Thus, understanding what nanomaterials are and why they possess unique properties, we now move on to their classification, with an emphasis on biocompatibility and bioactivity. The relationship between nanomaterials, biocompatibility, and bioactivity. Nanomaterials can be biocompatible, simply non-harmful to tissues; bioactive, interact with cells, stimulate regeneration, and induce the formation of bone and cartilage tissue. Thanks to controlled design, nanomaterials can be made not just compatible but also smart. For example, responsive to stimulate and capable of controlling drug biodistribution in response to specific triggers, both exogenous temperature fluctuations, magnetic fields, ultrasound intensity, light or electrical pulses, and endogenous changes in pH, enzyme concentration, or redox gradients. In other words, nanomaterials are not just very small particles, but a whole class of materials with unique properties that open new possibilities in medicine, rehabilitation, ecology, and other fields. Biocompatible and bioactive nanomaterials. A biocompatible material does not cause toxic, inflammatory, or immune reactions. It does not destroy cells or tissues and supports physiological processes. Examples include traditional titanium used in implants or medical-grade polyethylene. Bioactive material. actively interacts with biological systems, stimulates tissue growth, integrates with bone, promotes wound healing, or serves as a carrier for drugs. This interaction is crucial for therapeutic purposes. Biocompatibility and bioactivity are key concepts in biomedical technologies, determining whether an artificial material can not only take root in the body but also perform the necessary biological function. Modern nanotechnologies enable the creation of materials with precise tuning of these properties, opening broad opportunities in medicine, rehabilitation, dentistry, prosthetics, and even environmental protection. Nanomaterial engineering, achieving biocompatibility and bioactivity. Nanotechnologies provide unique tools to create materials with precise control over their properties. Particle size reduction. Nanoscale particles reduce immunogenicity, allowing materials to remain invisible to the immune system. Nanocoatings. Creation of coatings with adjustable chemical structure, charge, and hydrophilicity to optimize interaction with biological systems. Surface functionalization. Attachment of bioactive molecules such as peptides or growth factors to stimulate cellular processes. Smart nanomaterials. Development of materials that respond to environmental changes. pH, temperature, pressure for targeted drug delivery. Classification of biocompatible and bioactive nanomaterials. Nanomaterials are divided into several main types, each with unique properties and biomedical applications, opening broad opportunities for innovation. Polymeric nanomaterials, natural, collagen, and synthetic, polylactide polymers that are biodegradable and tissue compatible, widely used for drug delivery and creating scaffolds. Metallic nanoparticles. Particles of gold, silver, copper with antimicrobial properties, used for therapy, imaging, and photothermal effects, often functionalized for biocompatibility. Ceramic nanomaterials. Metal oxides, known for strength and stability, essential for creating implants that integrate with biological tissues. Composite nanomaterials. Combinations of different materials, polymer plus metal, for example, that combine the best properties of components to expand functionally and applications. Examples of applications: polylactide polymer nanoparticles, microcapsules of delivery of anti-cancer drugs, gold, photothermal cancer therapy, hydroxyapatite, stimulates bone tissue growth in orthopedics. Nanomaterials for drug delivery. The image illustrates the principle of nanoparticles transporting drugs. A nanoparticle loaded with drugs has targeting molecules, navigators, that help it to locate diseased cells. Upon reaching the target, the drug is released directly into the affected cell, increasing treatment efficiency. Examples of such nanomaterials include liposomes, gold nanoparticles, polymer nanocapsules, and carbon nanotubes. Key factors of biocompatibility. Biocompatibility of nanomaterials depends on several critical factors affecting their interaction with biological systems. Chemical composition. Absence of toxic ions or residual reagents is fundamental to avoid unwanted reactions. Specific surface area. A larger surface area increases reactivity, which can be both an advantage and risk for undesired interactions. Charge and hydrophilicity. These surface properties influence protein absorption and cell adhesion, which are critical for material integration. Surface structure. Nanotopography can stimulate attachment of specific cells, promoting tissue regeneration. Key factors of bioactivity. Bioactivity of nanomaterials is defined by their ability to actively interact with biological systems, crucial for their therapeutic and diagnostic applications. This property is expressed through several key mechanisms that promote tissue regeneration and targeted action. Induction of appetite formation. The material's ability to stimulate biological appetite formation on its surface, vital for bone tissue regeneration and mineralization. Release of ions and molecules. Controlled release of calcium, phosphorus ions or other bioactive molecules that promote cell proliferation and differentiation. Interaction with cell receptors. A specific interaction with receptors on the cell surface, ensuring a targeted response from the body and the material integration. Biocompatibility from the perspective of physico-chemical properties of nanomaterials. Biocompatibility is not just the absence of toxicity, but a complex phenomenon depending on the physico-chemical properties of the material and its interaction with biological environments. Understanding these properties is key to the successful integration of materials into the body. Surface properties and their role. Surface energy and protein adhesion. High surface energy promotes protein absorption, which can stimulate cell adhesion, excessive or random protein absorption, and activate macrophages and cause inflammation. Surface change. The electrical surface charge. The electrical charge of the surface of nanomaterials significantly affects their interaction with biological systems. It determines the placement and orientation of protein molecules forming the protein layer on the surface, influences the rate of formation of this layer and cell adhesion. Negatively charged nanoparticles usually activate the complement system less, whereas positively charged ones can cause cytotoxicity through interactions with cell membranes. Hydrophilicity and hydrophobicity. Hydrophilic water-attracting surfaces are generally more compatible with biological tissues because they promote even protein coating and prevent aggregation. Hydrophobic, water-repelling surfaces can cause unwanted protein aggregation and promote thrombosis, reducing their biocompatibility. Structure and nano-relief on the surface. Biophysical studies confirm that nanorelief surface irregularities, pores, significantly affect cell behavior. For example, nanopores with a diameter of 30-100 nanometers stimulate the attachment of osteoblasts, and oriented nanostructures can direct the growth of nerve fibers. This allows even chemically inert materials to become bioactive. Chemical composition and stability. Biocompatibility also depends on whether the material releases toxic products or ions. Alloys containing nickel or cobalt can provoke allergic reactions. Bioceramics, hydroxyapatite, are inert or even stimulate bone growth. Stability of polymers and nanoparticles in physiological environments is critically important to prevent the formation of toxic fragments. Magnetic and electrical conductive properties. Conductive nanomaterials such as graphene and nanotubes are used for stimulating muscles and nerves. However, it's important to control the current density, thermal effect, and the potential formation of free radicals. Magnetic nanoparticles, for example ferrum oxygen, are used in tumor hyperthermia due to their ability to heat up under the influence of an alternating magnetic field. Their biocompatibility largely depends on the protective coating, such as polymers or gold. Examples of nanomaterials applications. Nanomaterials modernize many industries thanks to their unique properties. Large surface area, quantum effects, controlled reactivity, and more. This paves the way for increased efficiency, reduced side effects, and the creation of fundamentally new technologies. The scope of applications is impressive in scale, from medicine and rehabilitation to ecology, energy, agriculture, and industry. Medicine and pharmacy. Drug delivery nanoparticles. Liposomal and polymer systems are used to provide targeted delivery of drugs to specific tissues, minimizing toxicity to healthy cells. Photothermal and photodynamic therapy. Gold or graphene nanoparticles convert light into heat, destroying tumor cells. Photosensitizers activated by lasers produce reactive oxygen species to eliminate tumors. Bone tissue regeneration and implantology. Nanostructured hydroxyapatite stimulates bone growth, and titanium oxide nanocoatings improve the integration of dental and orthopedic implants. One of the most promising materials in biomedicine, especially for drug delivery alongside other applications, is MXin. MXin, a material belonging to the class of 2D layered carbides and nitrides of transition metals. This unique group of nanomaterials is characterized by exceptional physical and chemical properties, making them ideal for modern medical applications. One key advantage of MXin is its large surface area, which provides a high loading capacity for various bioactive molecules such as chemotherapeutic drugs, notably doxorubicin. Thanks to this property, MXin can effectively absorb a significant amount of drugs, playing an important role in developing controlled delivery systems. Due to its large surface area, high biocompatibility, photothermal properties, and surface modifiability, MXin is used as a carrier for controlled drug delivery, often combined with hydrogels or nanocomposites for targeted release under near irradiation or pH changes. This allows reducing side effects and increasing therapeutic efficiency, particularly in oncology and regenerative medicine. Additionally, the MXin surface can be easily modified by adding functional groups, enabling customization for specific needs, such as binding certain molecules or improving cell interactions. Near irradiation, near-infrared radiation, is a part of the electromagnetic spectrum with wavelengths ranging approximately from 700 nanometers to 2500 nanometers. It lies between visible light and mid-infrared radiation. Key characteristics. Example in biomedicine. MXin nanoparticles, by absorbing near, increase the temperature to 40-50 Celsius, which breaks bonds with drugs or hydrogels, enabling targeted release in tumors or wound sites. Thus, MXin, thanks to its unique properties, opens new horizons in biomedicine. Its use in drug delivery promises increased therapeutic effectiveness and reduced side effects. Of course, further research is needed to fully unlock the potential of this material. Integration with modern technologies such as 3D printing or nanosensors could further expand in its applications, making MXin a key player in the medicine of the future. Rehabilitation and bioengineering. Nanomaterials in prosthetics and orthotics. Carbon nanotubes and graphene make prosthetics lighter, stronger, and electrically conductive. Nanostructured polymers enable the creation of smart ortheses that respond to patient movement. Tissue stimulation and neuroengineering. Conductive nanomaterials are used for electrical stimulation of muscles and nerves, supporting functional recovery after injuries. Tissue engineering. Nanomaterials are used to create 3D structures that mimic the extracellular matrix and stimulate cell growth for tissue regeneration. Ecology and environmental protection. Water and soil purification. Iron oxide nanoparticles effectively remove heavy metals. Graphene and carbon nanomembranes filter out organic pollutants and bacteria, providing clean water and soil. Agriculture. Controlled release nanofertilizers nourish plants while reducing fertilizer loss. Silver and copper nanoparticles protect crops from pests, and nanosensors monitor soil condition. Photocatalytic coatings. Titanium oxide nanocoatings, when exposed to UV light, break down organic substances, contributing to air purification and reducing environmental pollution. Energy and diagnostics. Energy. Supercapacitors and batteries. Carbon nanomaterials, graphene nanotubes increase capacity and charging speed while reducing device weight. On the image on the right, you can see the operating principle of a supercapacitor based on the charge-discharge mechanism of the electric double layer. Solar cells. Silver and gold nanoparticles significantly enhance the efficiency of converting light into electrical energy. Biosensors and diagnostics. Graphene-based sensors, exceptional sensitivity to disease biomarkers, enables detection even at nanomolar concentrations. Quantum dots. Fluoresce under UV light, allowing visualization of complex biological processes in living cells and opening new possibilities for diagnostics. Thus, nanomaterials demonstrate tremendous potential, from disease treatment and diagnostics to tissue regeneration, environmental cleanup, and the advancement of green energy. Their greatest achievement lies in the ability to control properties at the molecular level, making materials more efficient, environmentally friendly, and safe for humans. Nanotechnologies, challenges and prospects. The world of nanomaterials opens up unique opportunities for medicine, rehabilitation, energy, and environmental protection. However, it also brings complex scientific, technological, ethical, and environmental challenges. Understanding these challenges and prospects is essential for forming a responsible strategy for developing new materials. Nanotechnologies play a key role in modern scientific progress. Let's examine the main challenges and promising prospects facing this dynamic field. Scientific and technological challenges. Toxicity and long-term safety. Nanomaterials can interact with DNA and mitochondria, posing a risk of mutations. The long-term effects of nanoparticle accumulation in organs are still insufficiently studied. Biocompatibility strongly depends on the shape, charge, and surface groups of the material. Standardization and reproductibility. The properties of nanomaterials are extremely sensitive to synthetic conditions. Even minor changes in temperature, duration, or reagent composition can alter particle size and morphology, making research reproducibility difficult. Scaling up production. Many nanomaterials synthesized in the lab are hard to transition to industrial scale production due to high costs and the difficulty of quality control in large volumes. Ethical and regulatory challenges. Lack of regulatory framework. The rapid development of nanotechnologies outpaces legislation. Many new nanomaterials lack clear safety criteria, creating regulatory gaps. Ethical dilemmas. The use of nanomaterials in neuroimplants or to enhance cognitive abilities raises serious questions about the limits of technological intervention in the human body. Public awareness. There is a significant gap between the complexity of scientific data and public understanding. This may lead to unfounded fears or, conversely, unrealistic expectations regarding nanotechnologies. Pro Prospects for the development of nanotechnologies. Personalized nanomedicine, smart nanoparticles with biomolecules for recognizing the target cells, as well as targeted drug delivery based on a patient's individual genome. Stimulation of regeneration, conductive nanomaterials for neurostimulation and nerve pathway repairs, as well as bioactive nanocomposites for stimulating cartilage and tendon growth. Green energy. Carbon nanomaterials for high-efficiency supercapacitors and batteries, and nanostructured photocatalytic materials for hydrogen production. Environmentally friendly technologies. Nanofilters for removing heavy metals and organic toxins from water, as well as biodegradable nanomaterials or reduce environmental pollution. Integration with information technologies. Nanosensors for continuous health monitoring, e.g. glucose levels, tumor biomarkers, and the concepts of the Internet of the Body. Interdisciplinarity and the key to progress. The development of nanomaterials requires the combined efforts of various scientific and technological fields, physics and chemistry, to understand the fundamental properties of nanomaterials, biology and medicine, to study interactions with cells and tissues, engineering, to design advanced medical devices, law and ethics, to establish legal frameworks and ethical standards. In other words, nanomaterials are a powerful tool capable of radically transforming medicine, rehabilitation, energy, and ecology. However, it's important to remember that the advancement of this field is not only a technological issue, it's also a responsibility towards society and the environment. Addressing these challenges is possible through the integration of fundamental science, engineering, ethics, and an ongoing dialogue between science and the public. General conclusions. Nanomaterials have become an integral part of modern science and technology due to their unique physicochemical properties. They can be biocompatible and bioactive, actively interact with tissues, stimulate regeneration, and greatly expand the possibilities of modern medicine and rehabilitation. From the perspective of biophysics and biochemistry, biocompatibility depends on factors such as surface charge, surface energy, nanostructure, size, morphology, and chemical composition of the nanomaterial. These characteristics determine how nanomaterials interact with the body's cells and proteins. Along with promising opportunities come challenges: toxicological safety, manufacturing standardization, ethical dilemmas, and regulatory issues. The future of this field largely depends on an interdisciplinary approach and a responsible scientific stance. Nanomaterials are not just materials of the future. They are already a crucial tool in medicine, rehabilitation, environmental protection, and energy today, requiring deep scientific understanding and thoughtful application. Thanks for your attention.